Well, normal arteries need to be smooth. The inside of the arteries need to be soft, nothing covering, nothing like creating roughness. But with diabetes, of course, imagine like honey in a tube. It starts getting stuck everywhere and disrupting the normal flow of blood. So it helps blocking the arteries, and it also helps create a process which is called arteriosclerosis, which is the hardening and the hardening of the arteries. So it also helps create, if you were here in the past webinar, it helps develop high blood pressure also. But this is one of the things that could happen, and you can see there in the picture a normal artery versus a diabetic patient's artery. It also goes to your eyes, to the retina. The retina is the back part of your eye where the actual nerve comes and where the image is created, let's say that. So the blood vessels start to get damaged in that part of the eye, so people start getting blind. That's why a lot of diabetics go blind. And also, it affects two things. One of them is the scarring process. People with a lot of sugar in their blood, they do not heal as fast as normal people. And second of all, it attacks or it affects the feeling, the ability to feel. So people that normally you would feel something like you step on a nail or on a I don't know, yeah, on a nail, you would feel that you have something on your feet. Diabetic people do not feel, so they have a lot of injuries on the feet, and since they don't heal as good as normal people, they'll develop ulcers on the feet. Why the feet, not the hands or the chest or the face or the knees? Well, it's simple. I mean, since the feeling, the ability to feel, is affected in the whole body. But of course, your hands, for example, you watch them every day. It's very easy to check on your hands because you use them all the time. But your feet, you wear shoes, you wear socks. So if you have an injury there, you might let a couple of days pass without noticing, especially if you don't feel anything. So that's why the feet are very important for diabetic people. And this is just an example of what happens to all of that sugar. But these are like main characteristics of diabetics. But there are more things that could happen.